I'm at ASCO 2017 in Chicago. High dose therapy followed by stem cell transplant. It has been a standard of therapy for last 20 years for multiple myeloma. With the introduction of novel agents, because of the unprecedented response rates they have, a lot of investigators have sought to re-evaluate the question of the role of high dose therapy. Number of prospective studies has been done, and the outcomes of these studies have been variable. So this is for this reason that we sought to do a systematic review and meta-analysis of all the phase 3 randomized studies done in the context of modern era. We used the appropriate search term and searched Cochrane collaboration of control trials, Scopus and Medline. We also looked at the last 4 annual meetings of American Society of Hematology, ASCO and European Society of Hematology meetings. We found 2,480 articles, and out of that we excluded about 2,474 articles. 6 articles were reviewed, and out of that 4 articles met the criteria. The study selection included all the studies with the high dose therapy in a phase 3 design setting, comparing with the non-transplant based standard therapy in using the novel agents. The results of our study showed that the hazard ratio for the progression-free survival, the combined hazard ratio for all 4 studies was 0.55 with a significant p-value suggesting a significant reduction in the hazard of progression with the use of upfront high dose therapy in the context of novel agents. For response rate, we looked at the complete response rate. There was a higher proportion of complete response rate associated with the high dose therapy. And the overall estimation of the odds ratio was 1.27 for the complete remission. It didn't meet the statistical significance with the p-value of 0.07. So there was trend for the higher complete response rate with the upfront transplant. For the overall survival, with the updated analysis, we found that the hazard ratio is 0.76 with the non-significant p-value. So in conclusion, even in the context of novel agent use, we found that there was a significantly higher progression-free survival with the high dose therapy, a trend for higher CR rate, and for overall survival, given the fact that there are a lot of studies with a different follow-up, longer follow-up may be needed. One of the argument is all the patients in those studies had a salvage transplantation at relapse, so that might be the one factor might be affecting the overall survival. However, we think that longer follow-up, especially for the overall survival, we just included 3 studies. So after the overall survival result of the 4th study is published and long follow-up of all these 4 studies need to be repeated to find the real benefit in the overall survival.